Governor Dan McKee is extending Rhode Island's state of emergency that was put into place at the start of the pandemic. The governor issued an executive order today when the state of emergency was set to expire. Governor McKee did not say why Rhode Island is staying in a state of emergency. It will now last until April 13th unless it's extended again. The Massachusetts state of emergency was lifted in June of last year.
A version of the Omicron variant is fueling another COVID surge in parts of China, forcing 9 million into lockdown. Dubbed Stealth Omicron, or BA2, it was detected in Massachusetts and Rhode Island last month. Data shows cases have been decreasing steadily in Rhode Island for the last 8 weeks. 12 News reporter Alexandra Leslie spoke with a local infectious disease doctor about the potential impact a COVID spike across the globe will have here at home. Alex?
Well, Shannon, Dr. Leonard Mermel, who's an infectious disease doctor with Lifespan, says as we've seen over the last 2 years with spikes happening overseas with COVID cases, they could happen in some form here in the U.S. as well. China is dealing with a rise in cases from what's dubbed Stealth Omicron, or BA2, a more transmissible subvariant of Omicron.
There's no reason to expect that we would not see some sort of a similar effect here in the United States.
The most recent wastewater data from the CDC shows the U.S. may already be starting to see an uptick. In the 15-day period running from February 25th to March 11th, 9% of active wastewater sampling sites revealed an increase of 10% or more. 14% showed an increase of 100% or more, and 13% of sites increased by 1,000% or more.
And I think we'll see that in people.
However, how big of a jump in cases that is may vary based on several factors.
There's differences in terms of the type of vaccine we're using and the efficacy of that vaccine, how effective it is, as well as differences in public health measures.
Studies show getting a third dose of the vaccine is highly effective at preventing COVID-19 associated hospitalizations, but data shows less than half of Rhode Islanders are up to date on their booster shots.
And the best way to reduce one's risk of getting this BA2 variant, at times unknowingly spreading it to a loved one or a colleague or a neighbor, is to be up to date.
And Dr. Mermel says with all of the at-home testing being done now, that local health departments may not know of all the new cases evidenced by wastewater data. Now, the CDC has started measuring a community's level of COVID risk by looking at cases and hospital capacity and new admissions. Live in the control room, Alexandra Leslie, 12 News.
An update now. Governor Dan McKee has extended Rhode Island's state of emergency for COVID-19. The executive order was set to expire today, but the governor extended the state's disaster declaration through at least April 13th.
Locally, COVID-19 cases have been trending downward for 8 weeks, though the transmission rate and the number of people in the hospital were up slightly in today's report from the Department of Health. And unfortunately, another 4 people have passed away. Across the globe, countries in Europe as well as China are seeing spikes in cases.
12 News reporter Alexandra Leslie spoke with a local infectious disease doctor about what we're seeing in the U.S. and Rhode Island so far. Alex?
Well, Shannon and Mike, while cases and hospitalizations have been trending downward for weeks, locally data from the CDC shows that virus levels in wastewater, which serves as an early warning system for the emergence of COVID in a community, have been increasing in some areas of the country. Dr. Leonard Mermel, an infectious disease doctor with Lifespan, says with upticks in COVID-19 cases happening overseas, a similar situation could likely play out in the United States.
There's some evidence from this wastewater samples across in different cities in the United States of an increase, and I think we'll see that in people.
The CDC tracks COVID-19 levels in wastewater. Sampling sites in both Massachusetts and Rhode Island report their data.
It may be with a more home antigen testing that state health departments may not know of all the new cases that they're finding as evidenced by the wastewater. So it may take a little while, for that to catch up in terms of, let's say, PCR testing, the data that gets reported to state health departments.
Health officials in China are attributing its latest surge to a subvariant of Omicron, also referred to as Stealth Omicron, or BA2. A spokesperson for the Rhode Island Department of Health tells 12 News, well, not the 25% that is being reported nationally. We are seeing some BA2 in Rhode Island. BA2 accounted for 16% of our cases in February.
So it is here. It's more transmissible. And one of the problems we have in Rhode Island is less than half of adults are up to date in vaccination, meaning they've had the initial vaccine series and boosted.
Now, with St. Patrick's Day Thursday night and more celebrations taking place this weekend, Dr. Mermel is urging people to be cautious, especially if not up to date on their vaccines, and to consider wearing a mask if attending crowded events indoors. Live in studio, Alexandra Leslie, 12 News.